Hi, everybody. This is Kay Denault with Mental Health Association of South Mississippi. And joining me today is Jeffrey Savin. Am I saying that right? Savin. Thank you. I knew I was going to mess that up. Jeffrey and I met a while back. I believe we had some trainings that MHA did, and you came to that, so we got to meet each other. And then you've done some speaking here at our drop-in center as well. So thank you so much, Jeffrey, for being here with us today. Just wanted to start, can you just tell us a little bit about your background, first of all?
Well, I'm qualified, I guess, because, since I was retired from the military at the age of 19 for my nervous disorder, they called it at that time. It ends up being bipolar 1, which schizoid affective, but also drank and smoked a whole lot of weed throughout my life while I was in the military and after that. But, I have 10 years of sobriety, Valentine's Day 2010. And it's just been a struggle, but I'm blessed with those struggles today. I think it took me going to AA and involving myself in the program and working the steps with a sponsor numerous times. And most anywhere you go on the coast and you mention Jefferson, that hopefully people will smile. I know a lot of them know me, but it's been a gradual climb up. I mean, I remember when I first started going to 321 in D'Iberville, there was a recliner there at the time. They still had couches. And I used to sit there, and at first I could spit out some words. At first I didn't say nothing, but then I could spit out some words, and then eventually sentences, and then some paragraphs. And now it's hard to shut me up a lot of the time. But I mean, that was that progression, and it took a few years. And, and then I got interested in doing service work in AA, and I did that. I went to jail meetings. I advocated for the inmates that were interested in recovery. And, that led to me doing other things. Like 6 years into recovery, I found a group called Do Recovery Anonymous, and we did that for 2 years. But we didn't have any support from a central office. So after 2 years, I came upon Smart Recovery, and I decided to let Do Recovery go. And when I did that, Do Recovery ended here. And, Smart Recovery is different. It's a recovery system that's secular. It doesn't have much to do with God. It has to do with evidence-based tools of recovery, REBT and ABCs of recovery. So it's different, but I believe it's relevant. And since doing Smart Recovery, I don't identify myself as what I used to. But I mean, I like to leave my ego at the door, and when I go to a meeting, an AA meeting, I still identify myself as that, so that I'm still heard, But it's I'm as soon as this virus thing is over with, I'll because I've for 2 years now, I've done the meetings at the VA, the Smart Recovery meetings at the VA, and there's so many people that are coming to recovery that are mad at God or mad at whatever, and they deserve a chance to recover as well. I mean, and I'm a peer support specialist. I went through the training. I've never been employed as one, but I've been doing it for quite a while.
Mm-hmm.
But my job as a peer support specialist is to remove any block from anybody looking for recovery. So and I'm involved with a few different things. I know I've been to some Celebrate Recovery meetings. I know where they are. AA, NA, GA. I know where all these are. So if I sit down with you and have a 5-minute conversation, and you tell me what's up, I can tell you where to go.
Yeah.
And I can even give you a phone number or tell you who to talk to at the meeting. So, I mean, that's what I've been doing for quite a while. And, I worked at the VA for 1.5 years, and my idea as a housekeeper, and my idea was to get my foot in the door so that I could become a peer support specialist there in the VA system. But after working there for a year and a half, I really got frustrated with talking to people at VAs all across the country, trying to convince them to hire me to do something I was already doing. So that, after a year and a half, I decided this was not what I wanted to do. Didn't want to go to work, and that led to depression. And, because I didn't realize what self-worth was attached to my job. But then, I fell into some depression. Right before December, I had a manic episode, and I had to be hospitalized at the state hospital for a month, and then a week inpatient at the VA. But I didn't drink, I didn't drug, but I had to reset. And I spent a couple of months in bed, not wanting to get out of bed, as we do. And it took talking to some people. It took getting my medicine right. It took me wanting to get out of bed. And now, I'm getting excited about the things I want to do. There's something called the DBA Alliance, which has no meetings here. It's a mental health support group. It's not spiritually fueled or anything like that. It's just people sitting around a circle talking about their issues, and maybe somebody giving their ideas of how they dealt with these things. And as I've brought other groups to the coast into Mississippi, these are things that, when I first got into recovery, I was scared of my shadow. And these are things now that I'm doing that would have been silly impossibilities when I got into recovery. But now I'm doing these things. I mean, my wife and I are comfortable, all the bills are paid, and I can operate from that platform of helping, because everything's all right.
That's great.
And it's about accessing that peace that comes with no understanding. If I can do that, there's no fear. The fear's gone because I'm sitting right next to my higher power. So, that peace brings that. So today I understand better that I can do whatever I decide to do with an amount of work and God being with me, so.
Well, it sounds like, and May is Mental Health Awareness Month. So we really are trying to bring some pieces of information to people, especially right now with the stay at home, shelter in place, all those things happening with the pandemic. There's people who are feeling a lot more stress and experiencing some things that they never imagined they would. And so when I'm listening to you talk, it's helping me to understand better that someone hearing what you're saying hopefully will be thinking, okay, this guy is doing good but he had to keep trying. He had to keep trying different things. And I think sometimes people feel like there's like a magic pill or something. A lot of times when I guess people think of it as mental illness, when you go to the doctor because you've got an ear infection, for example, usually they'll give you some sort of antibiotic or whatever, and then it goes away. But mental health and the other issues that you talk to, they're not that simple. Do you agree?
I agree. And I do Toastmasters too. I go to a meeting every week, and I'm learning how to speak better and articulate, so that at some point I can go to council meetings around the area and walk in there in a nice suit and articulate what I'm saying and try to break down that stigma that I'm sure a lot of those lawmakers have about people that have mental issues. And it's like, because I've looked at the statistics, and I can tell a lawmaker that it's crazy. Since 2010, the beds in Mississippi have gone down, and the problem has only gotten worse. What's the deal? We need to put more money, but especially like what you do. The stuff in the community helps so much to keep people out of inpatient facilities. So if we can have more money to do more in the community, that'll take the load off of the hospitals in the area. And that's what we want. We don't want people to have to go inpatient if possible. Now, if there's a need for it, there's places around here, but there's not a whole lot. And I want to change that if possible.
Yeah, I think a lot of people agree with you, and there's, the bigger picture is difficult. Department of Mental Health has tried to make some changes and bring more community-based services out there. Of course, federally, there's been some push with the state to do just that. So I know that there's changes on the horizon, and I think like the Smart Recovery and the other meetings that you've mentioned, those are certainly community-based. Mental Health Association does the Wellness Recovery Action Planning workshops, and also Mental Health First Aid, which the Wellness Recovery Action Plan, the WRAP, is all about some simple tools that you can use to stay on track and kind of keep yourself in check. So I think that's super important for people. And then the Mental Health First Aid is just community members getting a better understanding of what to look for in a friend or a family member. What are those signs and symptoms? We all experience stress. We all experience some sort of highs and lows, but it's when things become to that extreme that we really have to, be kind of worried.
Yeah, and I'm in the midst of creating my own nonprofit, which is Kingdom Concepts. And the mission statement has all to do with helping people in recovery, whether it be housing, clothing, food. And I mean, it's just me at this point in my wallet. So it's small, but I can give you a receipt with my IRS number for whatever you give to me. So I mean, it's a start, and this is something I've always wanted to do. The name Kingdom Concepts came to me years ago when I worked at Goodwill, and I never knew what to do with it until just recently. So, I mean, I continue, and what I'm trying to do is remove all the stuff that I've placed between me and my higher power, so that I can access inspiration from him or her, and and go with that. I mean, because that's what helping people in recovery and helping myself is what makes my heart sing.
Yeah.
So that's what I do.
So Jeffrey, for people who may not have heard the terminology before, how would you describe the word recovery to the layperson?
I guess, when you do things that are detrimental or hurtful to yourself on a continuous basis, you reach a point where this stopped working. And then recovery is when you reach out, whether it be detox, rehab, or whatever it is, you reach out for help and learn how to live without those substances or those mind things that go on, dependency and those kind of things. I mean, you learn how to do those things better, get away from the things that are hurting you.
Mm-hmm.
Because, but you have to get to a point where you have to look around and say, this isn't working. I'm sitting, I mean, I've never been homeless, but, I'm sitting in front of Walmart with a cardboard sign asking for some food, and I might work for it, that kind of thing. And if you're there, then, and there's so many resources out there for people like that, if they would just look. There's resources, there's Catholic charities, there's you and what you do. I mean, I know Nicole does the housing thing to put people in houses. And I mean, there's resources out there, and unfortunately, there are people that want to be off the grid and in the woods, and they don't really want to get back to us, the world. But
not that many, though. You'd be surprised.
No.
I think it's a misconception that we hear sometimes that, oh, that person wants to live that way. And it could be that that's their escape and that's how they've chosen to live, but that could be because they don't have any support and they don't feel like that there's anything else. So a lot of times in the homeless outreach that we do here, you just have to build that relationship with someone and keep asking them. We've had people who have said, no, I want to continue to live this way. And the 10th or 12th time that we have that conversation with them, they may finally say, I'm tired of this. I do need something different. And then,
Mhm.
you know, they turn that corner. But
Well,
yeah,
yeah, when you get in,
sad.
when a person gets into recovery, there are so many different pressures going on. So what my nonprofit will do is provide clothes, food, housing, so those pressures are taken away. So a person can focus their all their energy on their recovery. And it works better when you do that.
Mhm. Well, Jeffrey, tell us a little more about Smart Recovery, that program. You mentioned that you liked it the way the setup is. It's based more on science and those things. Tell us a little bit about that.
Okay, well, it's and if you're interested in looking into it, it's smartrecovery.org. You can get on the website and go to meetings, Zoom meetings, or whatever you want to do there. And the people that run this organization, there's a few that are on like work that are doctors at Yale and Harvard, and they're also people in recovery. So, you know, part of the guidelines say that, you know, these things that are presented in the meeting, the tools are put together and checked out and done in meetings all over the world. And you know, it's like REBT, ABCs. You know, looking at reality, looking at what is actually going on. It's like, you know, okay, a guy comes into a meeting, he says, man, the entire world is out to get me. And it's like, whoa, 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 whoa. There's like 8 billion people on this planet. It's very unlikely that all of those people are out to get you. Now, there may be one or two or whatever, but 8 billion people are not going to be out to you. So you need to look at what is actually going on. And you know, these tools are what the therapists and the social workers are using to help their clients.
Mm-hmm.
And since I found it, I've been excited about it because it helps me. If I can look at these things, look at what's actually going on, you know, and and it goes along with what I'm trying to do with my God thing, clean out all the stuff between the stuff that stops me from getting where I want to go, and the mindset, you
Mm-hmm.
know, that I can't do this or I can't do that. Hell, I can do anything I want to do with an amount of work and touching base with my divine all the time, you know. But you know, smart recovery is a secular thing, so the mention of God is not in there, but when you look at the tools that we present, they're things that come out of scripture. But you know, I shouldn't have said that because now
No,
people
that's
won't come.
okay. I understand
But
you're
I mean,
touching on it. That's great.
all these things are about helping. And if you want to get better, you can get better. It takes some work. I mean, look, in 2010, when I first came into recovery, there wasn't a lot of conscious thought. You know, I was not well yet. Or well, I wasn't, you know, I'm not well today, but I wasn't well yet.
Mm-hmm.
And it took a gradual climb but it took me wanting that climb. It took me wanting to get better, and the work I was willing to put out to get there, and the universe got behind me, and now I'm 10 years sober. So
That's amazing. Well, congratulations. Um, it sounds like you've done a lot of work and put a lot of thought into it. And I can tell that you have the heart and compassion and you just want to help other people get to a better place. So that says a lot about your character. So thank you. Um, and two, I wanted to mention that along the coast, there are many different types of meetings. You mentioned NA, AA. There's all sorts of A's, GA, OA, all kinds of stuff. And so if someone is not even sure where to start, they can always call on us here at Mental Health Association and we can direct them to where a meeting is and, you know, possibly connect them to a person who can meet them there so it's not so scary feeling like you're just walking in all alone. So Jeffrey, thank you so much for sharing all of that with us. I appreciate your passion and all the hard work that you've done. So congratulations. All right,
thank
we'll
you.
talk to you soon. Thank you.